Connective tissue, it gets its name because it binds the other tissues of the body. Consists of supporting cells, then matrix, which is also called as intercellular substance. The intercellular substance or the extracellular matrix that consists of gel-like arrangement of organic material that is called ground substance, which is also called amorphous element, in which you may see a lot of fibers which are running within it. There are general connective tissue, hematopoietic tissue, which is blood, specialized connective tissue, which includes cartilage, bone, and joints. Let's see the cells of the connective tissue. Stem cells of the connective tissue are called the mesenchymal cells, which are undifferentiated cells which can differentiate into any other cell type. These mesenchymal cells, they usually convert into other cells, as I mentioned. It may convert into fibroblast, and fibroblast is considered as a main cell which is going to secrete the extracellular matrix, which contains the ground substance and the fibers. Then you have got adipocytes, mesothelial cells, macrophage, plasma cells, mast cells, pigment cells, reticular cells, and so on and so forth. In case of cartilage, we can see the chondroblast. So here the chondroblast is going to replace the fibroblast and it's going to produce the matrix. Whereas in bones, you may see osteoblast, which are going to be responsible for producing the matrix. Let's see the mesenchymal cells. Mesenchymal cells are the undifferentiated cells which are derived from mesoderm. They are multipotent stromal cells. They can differentiate into any other cell types like osteoblast, which produces bone, chondroblast that can produce cartilage, myocytes which can produce muscle cells or they are the muscle cells, then the adipocytes. Fibroblasts, they are flattened cells, cytoplasmic processes. They stain poorly. They have got a spherical or almost oval nucleus, which is at the center. These are the nuclei of the fibroblast, and these are the collagen fibers. Fibroblasts secrete collagen fibers and the ground substance. When fibroblast becomes old and inactive, and these are called as fibrocyte. There is something called myofibroblast, which are modified fibroblast. It has contractile property like smooth muscle. It is having a contractile function as well as it secretes extracellular matrix, that is ground substance and the fibers. Myofibroblast is a cell that is in between the fibroblast and the smooth muscle cell. Macrophages, they have irregular cell outline with small projections which are called as philopodia. It has a highly stained hypochromatic nuclei. Nuclei is usually round in shape and it is distributed in the connective tissue. In a general connective tissue, it is called histiocyte. In blood, it is called monocyte, whereas in the liver, sinusoids of liver, it is called Kupffer cells. Mast cells, these are large cells containing coarse granules within the cytoplasm, which can be seen as blue dots here. The nucleus is spherical. It usually resembles a cartwheel, as in this diagram. The granules contains heparin, histamine. Histamine is released from the mast cells and they will be moving onto the other cells and they will act on it. Now, when it is acting, it causes allergic reaction. So how histamine is acting on other cells? So the cells has a receptor for histamine. That means the other cells has got histamine receptors. So when the histamine is released from the mast cells, they go and attach onto the histamine receptors of other cells and they act on the other cells. So that causes allergic reaction. So in case of allergic reaction, antihistaminic drugs are given. So how they act? Don't think that they are going to reduce the release of histamine from the mast cells. That is not happening. Instead, they are going to occupy the receptor cells where the histamine would act. Pigment cells, they are usually called melanocytes. These melanocytes are present in the epidermis of skin, iris, and choroid of eyes. So they are star-shaped cells which has branching processes. Cytoplasm contains granules, pigment granules, which are called melanosomes. These cells are derived from neural crust epithelium. But we will talk about adipocytes in the coming slides. Remember, the matrix consists of the fibers and the ground substance. So what are the fibers that you can see in the connective tissue? The fibers are of three types: collagen fiber, reticular fiber, and the elastic fiber. But some of the books include reticulin fibers as the collagen fiber, which is classified as collagen fiber type 3. Collagen fibers, they consist of collagen proteins, which are made of tropocollagen. In turn, procollagen are made of procollagen. So procollagen, to form procollagen, vitamin C is mandatory. So in case of scurvy, which is a disorder where vitamin C level is very less, so in this case, you may have bleeding gums, loose teeth, poor wound healing, and the bone fragility. That's because the connective tissue element, that is, the collagen fibers, are not formed. Now, each tropocollagen, which consists of polypeptide chains, 3 polypeptide chains, and they contain glycine, proline, hydroxyproline, and hydroxylysine. So, when in case of some diseases called osteogenesis imperfecta, which is affecting the bones, where there will be breakdown of collagen fibers. In this case, in the urine, the amount of hydroxyproline level increases. Collagen fibers, which usually run in wavy bundles. But remember one thing, they never show branching pattern. This is very different from other fibers, that is reticular fiber and elastic fibers. Both of these fibers, they will show branching, whereas collagen fibers do not branch. There are 4 types of collagen fibers. Type 1 collagen fiber, which is usually seen in bone. Type 2 collagen fibers, which is seen in hyaline cartilage. Type 3 in smooth muscle cells of cardiovascular system. Type 4 usually seen in basement membrane. Elastic fibers, They branch and anastomose. They can be easily stretched and they will recoil in the same original position when released. So it is something like a rubber band. Now, as the age advances, the elasticity is reduced for the elastic fibers. That is the reason as you become old, there is wrinkling of skin. It is usually seen in aorta, lung, elastic cartilage, skin, vocal cords, ligamentum flavum, which is seen in the vertebra. Some bacteria like Pseudomonas aeruginosa that produces elastase, which is an enzyme which can act on the elastic fibers and it can disintegrate it. Reticular fibers are the fibers which are forming delicate supporting framework for the endocrine glands, lymph nodes, liver, basement membrane, and the bone marrow. Basically, reticular fibers can be seen in the lymphatic organ and the endocrine glands. Similar to the elastic fibers, they also branch and anastomose. And reticular fibers are usually not seen with hematoxylin and eosin staining. So they can be stained by using silver nitrate. So when we use silver nitrate, they get stained and appear as black, as in this diagram. So they are silver loving fibers, which are also called as argyrophilic fibers. Matrix consists of ground substance and the fibers. So we have discussed about the fibers. Now let's see ground substance, which is also called as amorphous material. So it has a property of semi-fluid gel. Usually it consists of polymers of carbohydrates associated with proteins. They mainly consist of proteoglycans and structural glycoproteins. So in this diagram, the cells can be seen, the fibers can be seen, and this area is the ground substance. Proteoglycans composed of a core protein to which carbohydrate molecules, that is glycosaminoglycans, are attached through a covalent bond. There are five major class of glycosaminoglycans which are there. Hyaluronic acid, which is seen in cartilage, chondroitin sulfate, bone, dermatan sulfate, which is seen in skin, keratin sulfate seen in cornea, heparin sulfate seen in aorta, which is a large blood vessel. There are some bacteria called Streptococcus pyogenes, which can produce an enzyme called hyaluronidase that can break down hyaluronic acid. Glycoproteins are adhesive material which usually bind the cells to the collagen fibers. There are different types of glycoproteins. Laminin, which is seen in basal lamina, fibronectin, seen in general connective tissue, which is attaching fibroblast to collagen fibers, chondronectin, seen in cartilage, osteonectin, which is seen in bone. They help to store the water, and that is called the tissue fluid. But when there is excessive accumulation of tissue fluid, that condition is called edema. Classification of connective tissue. Connective tissue can be classified into three groups. First one, general or proper connective tissue. Second one is embryonic or fetal connective tissue. Third one is specialized connective tissue. Now you may think what's the difference between a general connective tissue and a specialized connective tissue. Okay, so general connective tissue is usually giving a general support for the body. The main cells of these are the fibroblasts. As the name suggests, specialized connective tissue has got specialized function, and the main cells here varies. These may not be fibroblast. For example, in cartilage, the main cells are chondroblast. In the bone, the main cells are osteoblast, and they have a special function to perform. Example, cartilage and bone, that is going to give support. Adipose tissue is going to store the energy. Blood is for the transport. So that is the main difference between a general and a specialized connective tissue. Now moving on to the subclassification. General connective tissue can be classified as loose connective tissue. As the name suggests, the connective tissue elements are loosely arranged. Then there is dense connective tissue, which has a regular and irregular connective tissue. In case of embryonic connective tissue, there are two types, a mesenchyme and a mucoid connective tissue. Mainly it is Wharton's jelly. And as I mentioned before, specialized connective tissue consists of cartilage, bone, adipose tissue, blood, hemolymphatic tissue. Loose connective tissue, which is also called areolar tissue, which composed of loose arrangement of fibers, and the cells are dispersed in a gel-like ground substance, as in this diagram. And these are seen in areas where mobility is required, as in hypodermis, that is just below the skin, lamina propria of digestive system, endomysium, stroma of glands, which is going to support the gland. Dense connective tissue are of two types, dense regular connective tissue and dense irregular connective tissue. Let's talk about dense regular connective tissue. In dense regular connective tissue, the collagen fibers, they are densely packed and they are regularly arranged. That means they are arranged oriented in a parallel cylindrical fashion. The space between the collagen fibers is minimal. So it is unlikely to the loose connective tissue, areolar tissue, where you show a lot of space in between the fibers and the cells. Here, the space is very minimal. We can see this in tendon, ligaments, deep fascia, and aponeurosis. These are the examples where you can see regular, dense connective tissue. So here, a diagram can be seen with the fibers and the nuclei of fibroblast in between. The second type in dense connective tissue is that the irregular connective tissue. Now, in dense irregular connective tissue, remember that when we say dense, the space between the fibers is less, and the collagen fibers here in the irregular dense connective tissue, there are fibers which are interwoven to form a meshwork type of arrangement. This is formed in areas where you get stress from all the directions, like in the dermis of the skin, sheath of nerves, capsule of glands, kidneys, and periosteum. Embryonic connective tissue, we have got mesenchymal connective tissue, which is seen in embryo and consists of mesenchymal cells, which are pluripotent stem cells, which lies in gel-like amorphous ground substance. And they are usually stellate cells, which has got branching processes that join to form a network. The other type of embryonic connective tissue is called mucoid tissue, which is also called mucous connective tissue, in which there are cells. These are of fibroblast. They are located in amorphous connective tissue, exhibiting a jelly-like matrix. Here, hyaluronic acid is predominantly seen. Some round cells also can be seen in this. It is also known as Wharton's jelly, which is found in the umbilical cord, as in this diagram. Umbilical cord connects a fetus to the mother. Vitreous humor, which is seen in the eye. Now let's move to the next connective tissue, that is specialized connective tissue. So in the specialized connective tissue, as I mentioned before, there are some cells which are specialized cells here. For example, here it is adipocytes in adipose tissue. These cells are responsible for producing the matrix here. Unlike general connective tissue, where the main cells are fibroblast. Now, in adipose tissue, you can see the collection of adipocytes, which can be of two types: yellow and brown. Yellow and brown. Yellow is also called unilocular. It is also called adult type because it is seen in adult mainly. So let's talk about yellow adipose sites. So it has got a single large fat globule. The main function of adipocytes are storing the energy. So here you can see the fat molecule, that is a single fat molecule, and because of this big molecule, it pushes the nucleus into one side. So nucleus is peripherally located, and the fat cells are derived from lipoblast, which are derived from mesenchymal cells. Anyway, so talking about this unilocular adipocytes, because the nucleus is put to one side because of this fat globule, it looks like a signet ring, where it's a ring, and here the flat part of the ring represents the nuclei. And this is seen usually in superficial fascia, that is just below the skin, orbit, the bone marrow within the medullary cavity. The next type of adipose tissue is brown adipose tissue, multilocular adipose tissue, or it's also called embryonic type adipose tissue. It's called embryonic because it is mainly seen in newborn. Let's see the brown adipose tissue. Here you can see the adipose tissue brown variety, and this is yellow variety. So here, unlike this yellow, it was a single droplet here, or globule of fat, whereas here you can see multiple globules of uh, fat molecules can be seen here. So here in yellow, the nuclei was pushed to one side, whereas here the nuclei is not pushed to the periphery. So it can be seen in any part of the cell. Also, it has a lot of mitochondria compared to the yellow type. And as I mentioned before, it is seen in the newborn, also in hibernating animals. Moving on to the next, that is elastic tissue. So here we can see connective tissue, which is having a lot of elastic fibers within it. And it has branching elastic fibers. In addition to that, you may see a few collagen fibers in it. They are seen in aorta, that is the ascending aorta. Ascending aorta is connected to the heart. So when the heart is in systole, ascending aorta uh, gets expand because the blood from the left ventricle goes to the aorta, so it expands. And when there is a diastole, that means when the heart is resting position, when a short time, so that time you will see that the aorta will come back to the normal position. So this is possible. It's like a spring. It is possible because of elastic tissue. Also, it is seen in ligamentum flava of vertebral column and the vocal ligament, which is there in the larynx. It is usually yellow in color. Next type is reticular tissue. These forms delicate fibers, and they are commonly arranged in networks, something like a fishnet. Reticular tissue is seen in exocrine glands, lymph nodes, thymus, and so on and so forth. In bone marrow and spleen, it is associated with reticular cells. So these are the reticular fibers. Thank you.